NYC child care programs brace for cuts after federal funding freeze. New York City's child care system is facing uncertainty after the Trump administration announced a freeze on more than $10 billion in federal child care and family assistance funding to 5 Democratic-led states, including New York, California, Colorado, Illinois, and Minnesota. The Department of Health and Human Services, HHS, said the freeze affects key federal programs that support working families, particularly the Child Care and Development Fund, the Temporary Assistance for Needy Families, TANF, program, and the Social Services Block Grant. Together, these programs provide billions in subsidies for child care services, cash assistance, and social safety net support for low-income families. Administration cites fraud concerns. HHS officials justify the action by alleging concerns about fraud and misuse of federal funds in state-administered programs, though the administration has not publicly released specific evidence of wrongdoing. According to a department spokesperson, states will be required to provide extensive documentation before access to the funding can be restored. Officials for the administration have pointed to recent scrutiny of child care programs, including alleged welfare fraud in Minnesota, to defend the step as part of efforts to protect taxpayer dollars. Criticism from Democratic leaders. Democratic elected officials slammed the funding freeze as politically motivated and harmful to children and families who depend on these services. New York Governor Kathy Hochul has called the move vindictive and vowed that her state will fight the action in court. She argued that freezing funds will disrupt programs that help parents work or pursue education while caring for young children. U.S. Senator Chuck Schumer also condemned the decision, saying that using federal funding as leverage in political conflicts is unfair to innocent children and hard-working families across the country. Potential impact on NYC families. Child care advocates warn that the freeze could have grave consequences for tens of thousands of families. In New York City, many low-income parents rely on federal subsidies to afford child care for their children, services that enable them to work and support their households. Disruption of federal funds also comes at a time when child care costs are already high, and some programs are struggling with waitlists and funding shortfalls. Economists studying the region emphasize that without stable funding, child care providers may face closures, and families could lose access to essential services. For many parents, especially those earning low wages, these programs are critical to maintaining employment and economic stability. Broader political context. The freeze adds to a pattern of disputes between the federal government and Democratic-led states over the use of federal funding. Critics argue that broad, politically charged actions, including previous freezes tied to other social services, jeopardize vulnerable populations in states with differing political leadership. Supporters of the freeze, however, contend that federal oversight is necessary to ensure funds are used lawfully and effectively. As legal challenges and negotiations unfold, families, providers, and policymakers alike are watching closely to see how the disruption to child care funding will affect communities and the broader social safety net across New York and other affected states. Thank you for watching. Wishing you good health and happiness. If you found this video helpful, please like and subscribe to support our work.